Hello. This is the last part of the rubber dam series. Now I'm going to talk about why I use a rubber dam. I use a rubber dam because I want stress-free dentistry. I want to see better vision, better access, better lighting. I want to curtail the patient's talking. I want to curtail the patient's rinsing and spitting continuously. This saves time and that makes the procedure go faster, increase productivity and patient comfort. In my endodontic practice, I do two important things, which you probably don't know. I do a lot of vital pulp therapy. When I have deep caries, and I like to remove that deep caries, first I do pulp testing to be sure the pulp is vital, is healthy, is responsive. Then in my mind, if I'm not sure I'm going to do endo, I have to be honest with that patient. I have to be honest with God and the truth. Not every case is definite endo if it comes to me. Many dentists send me patients for consultation and proper action. That doesn't mean every patient come to my office, they have to have a root canal. Many times they don't. So I do a lot of vital pulp therapy. And as I've stated repeatedly, vital pulp therapy, caries control, removal of the caries near exposures. The best prognosis is stepwise pulp capping, is not to expose the pulp. If you have a rubber dam, and if you use sodium hypochlorite and disinfectant, or all these techniques which I explain in different areas, your chances of success are tremendous. The pulp has ability to recover, to heal. So I may not do a root canal. This is why I have to consider pulp capping. All of these procedures I do are surgical procedure. They need asepsis. And the best asepsis in restorative dentistry is utilization of rubber dam. The second procedure I do a lot in my care is the buildup, the composite, the bonded composite buildup is routine. When I finish the root canal, I need to protect my root canal. I don't use temporaries. I want to prevent microleakage. And for me to do a bonded composite restoration, whether it's a buildup as a foundation for a crown, whether I use a post or I don't use a post, rubber dam is absolutely essential for moisture control. So for those procedures that I do, efficiency, speed, patient protection, doctor team protection, when I have a rubber dam in place, the cheek is away, the tongue is away, the tooth is exposed, and guess what? The patient, the dental assistant is free to do more procedures for you instead of just retraction and isolation. So from any aspect you look at it, medical, legal, it's a standard of care. Absolutely. Safety, absolutely. Efficiency, absolutely. Quality of care, quality of procedures, quality of treatment, absolutely. And there is evidence. A study in Taiwan, Dr. Shang did comprehensive survey, 2 decades, thousands of cases. He went back and checked those cases they used rubber dam and those cases they did not. And they found the overall extraction of teeth was greater in those patients who received endodontic treatment without the rubber dam. And there are those dentists who says, oh, I use a rubber dam only in the posterior. No. Oh, I don't need a rubber dam because now I use rotary instruments, and instruments don't drop in the patient's throat. Unacceptable. It's not only the rotary and dropping instruments. It's the safety we talked about. It's the bacteria. So there's many factors, and I hope that these short videos, okay, will follow up with my website. Will have the techniques in which we have simplified the rubber dam utilization, and you see that also in my different courses. I thank you for listening.